Before I come on to tell you about the consultation process, I just need to let you know about our confidentiality policy. So what our confidentiality policy means is that we won't share any identifiable information about you with anybody without your permission first. The only possible exception to that would be if you were to tell us something that made us concerned for your safety or someone else's safety. That's a fairly standard confidentiality agreement across the world of counselling and psychotherapy, but just something that we need to make you aware of. So what can you expect from the consultation? Well, firstly, your therapy consultant, who is a trained psychotherapist or psychologist, will call you back at the time requested, and they'll speak to you for approximately 30 to 40 minutes. In that time, they'll be discussing with you the following topics. Firstly, they'll be thinking about some of the basic requirements, so what times and days will you be available, what are the suitable locations, what's your budget for therapy, some of those basic bits and pieces. Following on from that, which will be the main body of the conversation that you have with them, will be a discussion about the issues that are bringing you to therapy. Now, in that conversation, your therapy consultant will be exploring the history of some of the presenting problems. They'll be spending some time with you thinking about the context in which those problems have emerged, so thinking about your life more broadly, important relationships, so on and so forth. Some people ahead of the consultation can feel a little bit apprehensive about the possibility of difficult feelings coming to the surface during the course of having those kinds of discussions. Rest assured that if that does happen, your therapy consultant will be able to respond helpfully. They're kind, sensitive people who are used to having these sorts of conversations. Also, I think it's important just to add that there's no expectation that you'll talk about difficult things. If you decide that there are topics that you'd rather wait to discuss when you start therapy properly, then that's completely fine. That's your choice. Once your therapy consultant has spent some time exploring the problems with you, they'll then move on to thinking about what your goals for therapy are. Now, your goals for therapy will help provide a degree of structure and purpose when you start therapy, and they'll spend some time sort of co-constructing those goals with you so they make sense to you and that they're meaningful to you. Finally, at the end of the consultation, your therapy consultant will offer their recommendations. Now, in some instances, shortly before they do, they'll spend a few minutes just gathering together and thinking about the information before offering those recommendations to you. So I think that's all we need to cover in terms of the consultation process. So let's have a think about what happens if you decide to use Headroom's matching service. So what happens next? Well, at the end of the consultation, you'll have a couple of options. You can either use our matching service, where we would find a suitable therapist for you and arrange your first appointment, as well as sending your therapist a brief assessment report which outlines the main issues and your goals for therapy. The second option would be to use our consultation only service, which means that you just pay for the consultation that you've just had. If you decide that you would like us to find you a therapist, we would normally get back to you within 2 weeks. In most cases, we're actually able to get back to you much sooner with some first appointment dates, typically within a week, but sometimes there are variables beyond our control, which mean it takes a little bit longer. Once we've come back to you with some suitable appointment times and some information about the therapist or therapists that we found for you, if you're happy to then proceed and book one of those appointments, you will be asked to make payment to cover the first 2 therapy sessions. Now, that payment is made via Headroom, and any sessions beyond the first 2 you would pay the therapist directly. I think that's all the basic bits and pieces that we need to share with you for now. If you have any questions about anything in this video, feel free to ask your consultant. Thanks for your time and best of luck with the consultation.